What's going on, guys? Medicine in 3 minutes, back here with another video. And today we're going to be talking about statins, fibrates, and niacin, or vitamin B3. And we're going to be talking about how they can increase or lower your LDH levels. And we're going to go further into detail. So let's go straight to the point, make it clear, brief, and illustrated. So let's get started. Alright, so let's talk about statins. So statins are atorvastatin, simvastatin, and levastatin. And they're most known to lower LDL, which is low density lipoprotein levels. And you can think of it as left arm lower, and statins would be statues, so you think of this diagram to remind you. And it monitors liver enzymes, so don't forget that. So what is the mechanism? So the mechanism inhibits the enzyme HMG-CoA reductase, and the side effects are myopathy and hepatotoxicity. So clear indications for the use of statins are acute coronary syndrome, MI or stenting, or any arterial disease. So if it's greater than 7.5%, there is a 10-year risk of CAD. Don't forget that. So let's talk about fibrates now. So fibrates are gemfibrosal, clofibrate, bezafibrate, and fenofibrate. They're most known to lower triglycerides, and the mechanism increases lipoprotein lipolysis. Alright, so what are the side effects for this? So it's either myopathy or gallstones. Those are the two main side effects. So now moving on to niacin vitamin B3. So it is most known to increase LDH levels, and the mechanism inhibits lipolysis in adipose tissues and inhibits hepatic VLDL synthesis. So what are the side effects? Flashing via prostaglandins, which is you can correct by aspirin, or hypotension, hyperglycemia, or the gout. Alright, so down to the last one. So bile resins. So that is mainly cholestyramine, cholestyramine, and cholestyramine. They're most known to lower LDL levels when TG levels are well controlled, and slightly increase triglycerides. So TGs. The mechanism, it blocks intestinal reabsorption of bile, and the side effects are terrible taste or gallstones. So ezetimibe, the mechanism blocks cholesterol intestinal absorption at the enteroside, and the side effects are diarrhea. Don't forget, yeah. So as the little diagram here, it blocks cholesterol intestinal absorption. So don't forget that. Alright, so just a quick reminder to wrap up the video, a quick summary. So statins lower LDL, bile resines lower LDL, and fibrates lower TGS. Now, niacin B3 increases LDH, and ezetimibe blocks cholesterol absorption. So that's really the key factors you need to remember after this video. So just keep that in mind, and I'm sure you'll be set to understand this concept. So yeah, that about sums up this episode of Medicine in 3 minutes. I just want to thank you guys for watching, and enjoy the rest of your day. And don't forget to like, subscribe.